The Office of the Attorney General of Ecuador has opened an investigation into more than 10 public hospitals and health districts due to allegations of corruption in the midst of the coronavirus crisis. The United States government continues to deport migrants to Latin America despite the risk posed by the novel coronavirus. A new World Health Organization study has warned that almost 250 million people could be infected with the novel coronavirus across Africa unless urgent action is taken. From the headquarters of Telesur English in Havana, Cuba, this is From the South, I'm Katrina Goss. The Office of the Attorney General of Ecuador has opened an investigation into more than 10 public hospitals and health districts due to allegations of corruption in the midst of the coronavirus crisis. Attorney General Diana Salazar informed that 14 operations have been carried out in 10 cities so far, which are related to embezzlement, unlawful association, as well as influence peddling and extortion. The Attorney General's office condemned the use of the health emergency for the gain of individuals or selected groups and called to rethink the way state resources are managed in health services. Activists, journalists and human rights defenders have denounced police repression during a protest held in the Ecuadorian city of Guayaquil against the latest decisions adopted by the government in the face of the health crisis. Our correspondent Denise Herrera has the details.
There is growing criticism of the government of President Lenin Moreno. The coordinator of social organizations of Guayas recently called for the demonstration outside Parque Centenario in the city of Guayaquil. Human rights defenders, activists, students, women, workers and pensioners were attacked by the national police, despite protesting peacefully. The protest was held in response to the cut of the education budget, as well as a lack of measures and breach of protocols in the handling of corpses of victims of COVID-19 and other diseases.
We have gathered under the slogan "In Mourning and Resistance." In mourning to honor our dead who have left us in the context of COVID-19, not only the official figures that already stand at more than 2,000, for the crime committed in education and health and the economic measures that attack us as citizens.
The images of the repression went viral on the social media, along with the complaints of the illegal detention of several protesters.
When we arrive at Rumichaca Street, they surround us and force us into that deserted street, and they began to brutally beat us with their clubs and shields and force us to move so that the people of 9 de Julio wouldn't see what was happening. Then they unleashed the brutal violence, senseless violence, because we understood that we could not negotiate and we decided to leave, and they told us to go away. But minutes later, we realized they didn't want us to go away. They wanted to take some of us prisoner, and they provoked us in those blocks and managed to seize some comrades.
4 human rights activists were arrested for the alleged crime of verbal aggression against the national police during the demonstration and in the midst of the health crisis. It's interesting that despite these events being reported and the fact that even the Ombudsman's office was warned of the harassment and criminalization of human rights defenders, there has not yet been any official statement by the government or coverage in local media.
Denise Herrera, Telesur, Ecuador.
Guatemalan Health Minister Hugo Monroy denounced the United States government for deporting Guatemalan citizens with COVID-19 symptoms.
This is the situation. There are flights with Guatemalan citizens who have been deported from the United States and who are put on the planes and they have fevers. And so once they arrived here, we automatically evaluate their health, immediately test them for COVID-19, and a lot of them have been testing positive.
In the context of Teachers' Day in Mexico, President Andrés Manuel López Obrador announced that schools will be reopened gradually according to the epidemic situation in each region.
The number of municipalities with no confirmed cases or any positive neighbors is going to be updated. To see many of these municipalities there are, we have identified where we can restore all activities and, of course, the return to classes. And then, as the events unfold, according to the seriousness of the pandemic, we are going to declare green areas where classes can be resumed.
A campaign to combat the coronavirus has been rolled out in the Brazilian city of Rio de Janeiro with the hope of reducing infection rates in crowded neighbourhoods. Our correspondent Brian Meir has the details.
Made up of 16 connected favelas in Rio de Janeiro's north side, a community organization has started a campaign against coronavirus.
The goal of this campaign is very clear. It's designed to last for 3 months and was made based on a database we created from data from our neighborhood census on the 6,000 most vulnerable families in our community.
In situations where social distancing is difficult, such as favelas, Brazilian health officials recommend that people get enough calories per day and frequently wash their hands. So working with governmental and private donors, Hedges has started distributing groceries and hygiene items to 6,000 families in Mare.
Other institutions are helping us with the sanitization procedures, which is essential. So we are donating high-quality food that is sanitized, so that we can protect the health of the volunteers and the people who are receiving these donations.
It is hoped that this, coupled with constant communications with residents on the need to wear masks and take other precautionary measures, will reduce transmission in this impoverished neighborhood of 140,000 people. Brian Meir, Telesur, São Paulo.
Intellectuals and progressive leaders of the Puebla Group held a virtual meeting on Friday to discuss the social and political crisis in Colombia. Participants evaluated the state of the Colombian peace process, its verification and follow-up. Regional personalities also analysed the ongoing armed conflict, which has left nearly 100 social leaders dead this year. The Puebla Group also reviewed the health crisis sparked by the COVID-19 pandemic. Former President of Colombia, Ernesto Samper, stressed that progressive sectors in the country are seeking to build an agenda that addresses both the health crisis and the wider socio-economic and political crisis in Colombia. Meanwhile, on addressing the group, Argentinian President Alberto Fernandez highlighted the importance of a progressive approach and emphasised that after the pandemic, the world will not be the same and will require alternative solutions to its problems. And in the framework of the fifth meeting of the Puebla Group, President of Argentina, Alberto Fernandez, stated that the health crisis sparked by COVID-19 has exposed the huge social inequality generated by finance capitalism.
Because we have to think about it in a different way. Because if one thing has been exposed by the coronavirus, it is also the inequality. It has revealed that finance capitalism concentrated huge resources in the hands of a few, and concentrated suffering and poverty in many others. And it has also revealed that inequality is not a good path to be able to face critical situations like this one. And it has exposed that in many places of the world, the word solidarity was tossed aside, and the word solidarity in a society should be the common denominator that unites us and helps us.
Former President of Brazil, Luis Inácio Lula da Silva, called on the Puebla Group to promote a meeting at the UN to discuss the situation in the midst of the COVID-19 pandemic.
There is no meeting or call from another countries to insist and assume a responsibility to continue contributing to the World Health Organization, which is the body that provides guidance to the rest of the world. I believe that we, from the Puebla Group, could prepare and insist that the UN Secretary General decree a meeting of a group of countries to discuss the coronavirus, to discuss the pandemic more seriously. He has no right to submit remedies. This Bolsonaro has no right here in Brazil to invent remedies. They have no rights to demand people return to work without providing guarantees to protect their lives.
The number of COVID-19 cases continues to climb in the Caribbean, with the Dominican Republic the worst hit country in the region. The Dominican Republic has reported more than 11,700 confirmed cases and over 400 COVID-19 deaths. It's followed by Cuba with over 1,800 positive cases and 79 fatalities. Meanwhile, Jamaica has reported more than 500 cases, but its death toll remains at 9, having not reported any new fatalities in the last week. They're followed by Haiti, Martinique and Guadeloupe as the countries with the highest number of cases reported in the Caribbean region. More stories coming up after this very short break, so don't go away. Welcome back to From the South. And we turn to the United States now, where nearly 40% of low-income workers have lost their jobs as a result of the economic impact of the coronavirus pandemic. A Federal Reserve report released on Thursday indicated that 1 in 5 adults working in February reported being laid off or furloughed in March or early April as a result of the pandemic. The data collected in the report does not include the millions of unemployed Americans since early April, when the unemployment rate rose to 14.7%, the highest since the Great Depression of the 1930s. The number of COVID-19 cases in the US has reached over 1.4 million, while the death toll has surpassed 87,000. The United States government continues to deport migrants to Latin America despite the risk posed by the novel coronavirus. Our correspondent Jorge Gestoso has the details.
Thank you. Even during the pandemic, the U.S. government continues to deport immigrants to Latin America from detention centers that are considered hotspots for coronavirus, and therefore many of them has had the virus and they arrive to their native countries exporting, therefore, the COVID-19. This is a case, for example, in Guatemala that since May 4th, there have been 117 cases of deported people that have been tested positive to the virus. And the health minister has said that what the US is doing is becoming the Wuhan of the Americas, meaning the city of China where everything has started. And the same thing is happening with immigrants that came to the US and has been put in detention centers from Haiti. In the case of Haiti, we're talking about that at least 4 of them has been acknowledged of having the virus when they arrive, and they have created most definitely a pandemic because there are countries that do not have the resources or the infrastructure to combat the virus. In the case of Guatemala, for example, those 117 cases that were arriving, they were representing 50%, 15% of total cases just in one flight. The situation is very complicated because the policy of the US is to continue to deport precisely the immigrants, and again, that is considered by many Latin American countries like the US is exporting to their region the coronavirus. We get back to you now.
Slovenia is the first European nation to declare the end of its coronavirus epidemic. Authorities of the mountainous nation of 2 million people reported on Friday that the COVID-19 virus is under control and there is no longer a need for extraordinary health measures. According to Prime Minister Janez Janša, Slovenia has the best epidemic situation in Europe, and European Union residents are free to cross into Slovenia from Austria, Italy and Hungary at predetermined checkpoints, while most non-EU nationals will have to undergo a mandatory 14-day quarantine. Slovenia has reported over 1,400 coronavirus cases and 103 deaths. More than 12,500 deaths of care home residents in the United Kingdom were linked to the coronavirus, according to figures released this Friday. The news heaps further pressure on the UK government over its mishandling of the pandemic. The Office for National Statistics suggested the actual death toll of care home residents could be far higher, noting it had recorded over 23,000 more fatalities in the first 4 months of the year than in the same period in 2019. According to official data, Britain has the second highest COVID-19 death toll in the world. In this context, the government is pushing for the reopening of the economy and encouraging people to return to work. Over 3 million residents of the Chinese city of Wuhan, the original epicenter of the novel coronavirus outbreak, have been tested for COVID-19 since April, and efforts continue to test the rest of its population of 11 million. Wuhan residents have queued up across the city, keeping their social distance, to be tested after a new cluster of cases sparked a mass screening campaign. According to official figures, more than 3,800 people have been killed by COVID-19 in the city, accounting for the vast majority of fatalities in China. The lockdown imposed in January was only fully lifted in early April, and life is gradually returning to normal. And China urged the United States to meet it halfway on Friday and strengthen cooperation in the fight against the coronavirus pandemic after President Donald Trump threatened to cut bilateral ties.
To maintain the steady development of China-US relations is in the fundamental interests of the people in both countries and is conducive to world peace and stability. At present, China and the US should continue to strengthen cooperation against the epidemic, defeat the epidemic as soon as possible, treat patients and restore economy and production, but it requires the US to meet halfway with China.
Russia confirmed close to 10,600 new coronavirus cases on Friday, bringing the total to over 262,000. Russia now ranks third in the world in terms of the number of cases reported. Meanwhile, early clinical trials of an antiviral drug in Russia have provided promising results in treating the virus. Russia's health minister said on Wednesday that he expects to start clinical trials for possible coronavirus vaccines in June. Meanwhile, authorities in Moscow have rolled out free coronavirus antibody testing for all residents. The capital has reported the highest number of cases in the country. And we're taking one final break now, but stay with us for more. Welcome back to From the South. A new World Health Organization study has warned that almost 250 million people could be infected with the novel coronavirus across Africa unless urgent action is taken. According to the modelling study, as many as 150,000 people on the continent could die within a year unless urgent measures are adopted, although the study's authors predicted a lower infection rate than in other parts of the world. There's a concern that African countries' health systems won't be able to handle mass cases. Researchers warn that surging hospital admissions for COVID-19 would divert already limited resources to tackle major health issues in the region, such as HIV, tuberculosis, malaria and malnutrition, thus worsening the impact of the coronavirus. African nations have reported over 75,400 cases of the coronavirus, according to a Friday update from the Africa Centers for Disease Control and Prevention. The report also stated that more than 2,200 COVID-19 fatalities have been registered, while the number of active cases on the continent stands at over 45,000. North Africa remains the most affected of the continent's 5 geographical regions, with 25,000 cases, followed by West Africa with more than 22,000 cases. South Africa is the worst hit country in terms of the number of cases reported at more than 13,000, followed by Egypt with over 11,000 cases. The mayor of Somalia's capital, Mogadishu, has warned that the actual COVID-19 death toll may be 10 times higher than official figures. Mayor Omar Mohamed highlighted higher than usual death rates for the capital, which he suspects are due to the novel coronavirus. Somalia has officially reported 1,284 coronavirus cases and 53 deaths. The comments by the mayor are echoed by workers in one of the city's largest cemeteries, who said they were preparing more funerals than ever before. Many families in Somalia do not register deaths, but prefer to simply bury their dead on the day they die in accordance with Islamic customs. This makes the data on deaths and their causes extremely difficult to collect. Many patients are also more likely to stay at home than seek medical care, as they can't afford to be hospitalized. Somalia has one of the weakest health systems in the world after decades of civil war. Eritrea has officially declared itself virus-free after all 39 COVID-19 patients successfully recovered from the virus. As of May 8th, there were only 2 active cases in the country, one of which was discharged on Monday, while a Ministry of Health statement confirmed that the 39th patient had been discharged from hospital this Friday. Eritrea follows the likes of Mauritania and Mauritius, who have reported the full recovery of all identified coronavirus cases. However, Mauritania has since recorded new cases. Eritrea is also among a handful of African nations that have not recorded any COVID-19 deaths, including Madagascar, the Central African Republic, Mozambique, Namibia, the Seychelles, Lesotho, Rwanda and Uganda. Hundreds of girls in Ethiopia face greater risks of being illegally forced into marriage under the age of 18 as the coronavirus pandemic has kept them out of schools. More than 500 girls have been rescued from child marriage in northern Ethiopia since schools were shut due to the coronavirus pandemic, according to Adele Kodra, UNICEF representative in Ethiopia. The country closed its schools in mid-March, sending 26 million children home, sparking fears that the pandemic is reversing years of work to stop underage unions. The UN predicts there could be an extra 13 million child marriages by 2030 as COVID-19 hits household incomes and impacts global efforts to end the practice. And we finish this news brief with a song produced by a host of Caribbean artists that calls for regional unity and joint efforts to tackle the coronavirus pandemic. The video features a group of Cuban nurses arriving at the monument to the martyrs of Barbados as recognition of the medical collaboration offered by Cuba to several countries of the region. Remember to follow us on social media for all the latest news. For Telesur English, I'm Katrina Goss, and thank you for watching.
We're gonna make it. What do you mean?